Across the country, millions of people are living with Alzheimer's and dementia. In most cases, they need extra help or long-term care. But that care can be thousands of dollars, and many cannot afford it. Team 10 investigator Adam Rakusin explains the cost of long-term care and planning for the unknown.
The way I get through all that's been going on with Paul is I look for the blessings.
When you're in love,
We've been married 39 years. So
there's nothing you wouldn't do to spend time with your other half.
what would I want if the roles were reversed? If I were the one with Alzheimer's, what would I want him to do? And being with me is what I would want. So that's what I'll do for him.
So every day of every week, Linda Smith makes this 20-minute trip from her home in Encinitas to a memory care facility in San Marcos to see her husband, Paul.
Hi, Kyle. Can we go back to your room?
Linda and Paul met 40 years ago.
Blind date in Oklahoma City.
3 weeks later, Paul proposed.
I made him wait a month before I accepted.
Love at first sight.
A chance meeting turned into an adventure of a lifetime. But just as life has a way of pulling you in with its beauty, it can also be ruthless, ripping at the seams of a once unbreakable bond.
Paul, you doing okay?
At the age of 62, Paul was diagnosed with early onset Alzheimer's.
He had a very slow decline for the first 4 or 5 years. And in the last year and a half, 2 years, it's been much more rapid, especially this year. It's been bad.
When it became too dangerous for Paul to live at home, he moved into this memory care facility about 10 miles away.
Paul, you doing okay? Okay.
Linda says Paul's new home costs $8,600 a month.
I look for blessings, and one of the blessings was the long-term care insurance that we were able to obtain prior to his diagnosis, thank God.
Linda's a planner. She also worked in the healthcare industry, knew the cost of nursing homes, and her own financial status. Linda weighed the risk of long-term care insurance premiums against the chance she or Paul would ever need help.
A lot of people don't get it not because they don't want it or might need it, but because they can't afford it. The premiums for the two of us together ran $6,000 a year.
On top of everything else.
Yeah, $500 a month.
Her plan covers up to $8,000 a month. That's more than 90% of Paul's memory care center costs.
If we didn't have long-term care, we'd be pulling from his and then my retirement accounts. I'm planning on living to a ripe old age after we're done with this journey. And we would decimate, the accounts without this.
Long-term care insurance can cover most skilled nursing homes, home care coverage, and residential-type care facilities, among other things. But it's an added expense. According to the AARP, about 70% of Americans who reach 65 will need some long-term care. Yet the percentage of those who have it is nowhere near that.
Insurance is tricky with memory care and Alzheimer's as a whole.
Janet Hamada Kelly is the head of the Alzheimer's Association in San Diego. Their numbers show the median cost for an assisted living facility last year was about $57,000. For a private room in a nursing home, that price went up to $115,000.
If we look at the facts of 1 in 3 will have some form of dementia or Alzheimer's by the time they pass, that's impacting a lot of people. And as our population gets older, we will see more and more cases.
In the Pacific Northwest, lawmakers are trying to help with those costs.
For everyone in the middle, they're exposed to the risk of this bankrupting them or, making people have to quit their jobs to care for a parent, for example, or a spouse.
Ben Vighetti is the director of the WA Cares Fund. This year, the state of Washington launched a state-run long-term care insurance program.
The WA Cares Fund is a program which makes it possible for the broad middle class to have access to affordable long-term care insurance for the first time in the history of this country.
Workers in Washington have a little over 0.5% deducted from their paycheck. After a decade of contributing, they'll be able to get up to $36,500 for long-term care. That amount can go up with inflation. The state of California is also looking into a long-term care insurance program. A task force found most Californians can't afford 3 months of nursing home care. Almost half can't afford even 1 month.
It means so much to me to be able to be with Paul as much as I can. And I know Paul appreciates it.
Despite losing her husband 1 day at a time, Linda knows things could be worse. So she soaks up what she can.
You doing okay?
A simple touch here, a laugh there.
He's napping.
No, I'm not.
No, you're not.
Moments Linda can hold on to, knowing it's what she'd want if the roles were reversed.
I think back to our marriage vows. It's the one part of the ceremony that I really stuck in my head. Instead of for better or for worse, it was through the goodness that brightens our days and the sadness that darkens our days. This is the sad time. But at the same time, we try to make whatever joy we can and find the blessings and the joy.
That was Adam Rakusin helping us to see the blessings and the joy. Linda told us some of Paul's favorite things were watching Formula One racing, spending time with his kids, and holding her hand. Wow, I didn't think I was going to get emotional. All this week on ABC 10 News, we're looking at the cost of care. Tomorrow, we'll explore financial and emotional solutions for families